Hi, I'm Dr. Heather Hammonds with Restore Regenerative and Sports Medicine. Today I want to do a little deeper dive into what is stem cell therapy. It is an area with a lot of promise. However, we have had a lot of bad players here recently. Specifically, clinics moving through, preying on smaller towns, kind of a traveling salesman type ploy. And so just keep your eye out for this type of salesman coming through. May end up being a physician behind it. So I just wanted to kind of give you a little information so you understand what stem cell is so you can ask the right questions. First of all, stem cells themselves are an important part of regenerative medicine. They are harnessing your body's own ability to heal. So we're using some of these live cells to be able to help to encourage a healing process. Depending on what is exactly used, there may be some degree of regenerative versus sometimes it's more of inflammation that it's improving. But overall, you are getting some degree of healing response. As of now, the stem cells that we do have are two main types. One is your autologous, which means auto means from you. So mostly that would be harvesting bone marrow or fat, so your own fat, so the liposuction applied to the area that's needing healing. The second type is perinatal products. So you may have heard of like amnion, orange jelly, some of those type. So the only ones that are approved in the United States at current are autologous. So it should always come from you right now. And until further research is done, this was even from 2019 that was pulled back. So yes, there may have been prior to that was allowed, but since then, these are not FDA, not only are they not FDA approved, they're not legally on the market, which is different from if we just are using things off label, which as physicians we do all the time. This means that it does not have the approval to even be sold. Even though that's an area that has promise, it's not legally out there just yet. The question may arise, if you're older, that your stem cells just are not as robust. And this is true. As we get older, our stem cells are not as active. There are measures that we do actually using our shockwave, which I've talked about before, can stimulate some improvement in your stem cells. There are different techniques, even some movements towards like peptide therapies that can encourage improvement in your how you're activating your stem cells. This is what's legal, and so this is ways that we can improve that. And in regards to orange jelly, even though that does come from an umbilical cord, from a live pregnancy, even those cells are robust and live at that time. However, upon processing that in further studies, there are no live stem cells once that is ready to be injected. So what you're getting is actually the growth factors and just decreased inflammatory response. So it's not due to stem cells, any improvements you have. And to be clear, these are not the type of stem cells that are going to make you into a lizard where you regrow a new cartilage altogether. This is improving your healing response. So questions may come as far as what to expect if you were to do a stem cell, and how does that process. So in regards to if you choose to do the stem cell therapy, that is all done in one visit. Once you've been assessed and evaluated and determined that you're a good candidate, we will do a blood draw, because we often do combine that with PRP. We use the analogy of a garden. We're going to plant the seed, but we're going to also fertilize it. So we use the PRP as our fertilizer, and then we use the cell therapy as our seed. So that may be from your bone marrow, or it can be from fat. Both of them, we take your comfort into consideration. We do have use of nitrous oxide is needed to make you more comfortable during that. With that being said, with some local, actually majority of people are surprised with how comfortable they are through the process. Once that's been harvested, then we will use our ultrasound to be able to assess your area of pathology and to precisely administer the PRP as well as the cell therapy into the area of pathology. It doesn't stop there though. We always take care of the full package. So from there you come back in for shockwave treatments as well as your physical therapy until you have received the desired results. So the biggest question and the biggest issue I can press is the legality again. I mentioned before, these are not legally on the market as far as when we're talking about from you, autologous versus perinatal or allogenic. So the bottom line are questions that you want to ask if you have someone who is pitching that they have this service available to you. Is one, how are they assessing that you're a good candidate? Majority of the people are not going to need a stem cell therapy. Many of the things like our shockwave, our PRP are going to be more than adequate. Now, if you have a more severe tear that's not retracted, again, this is where it comes in, having someone who is a deep understanding of the musculoskeletal and knowing when it's appropriate to send towards surgery versus these treatments. So if you have more of a partial tear and it's a larger tear, then that might be someone who's a candidate for a cell therapy, specifically more of the fat therapy. If it's someone who's more advanced arthritis and just isn't a candidate for replacement, then that's something to consider. With that being said, the clinics that have continued to provide or to give this service of more perinatal products have been receiving letters of concern from FDA. Some clinics have even had to go to court or even are at risk of losing their license over that. So always be aware of these practices and making sure that you are finding a legit clinic that is practicing best practices. The other things you want to ask are, where is it harvested from? How do they inject that? What kind of techniques are they using? Guidance. If they're not, again, don't pay for something where you can't know that it's not precisely provided. And then also ask, when it's all said and done, are they just going to skip town like attorneys that have been coming through, giving you a free steak dinner and taking your money, and then they're gone? What happens after you have either an adverse outcome or you just don't get the response that they promised that you get? Stay local. Look to people you're going to have to see at HARPS, who will see in the community and have to face you if you have a bad outcome. As always, as we've said over and over with all of our modalities and discussion, remember that experience matters, dosing matters, precision matters. We're here for you if you're having any type of joint, neuropathy, musculoskeletal issues, and that are just really affecting your quality of life or impacting your ability to get back into the game. Come see us. We're happy to get you back on the road.